touching the bony socket here. And notice the cul-de-sac here, which is the opening, which is enabling me to get a bigger area to catch the drop. And then we just put the drop in so you can't see it yourself, and it goes in, and as soon as you feel it, you blink, it distributes across the eye evenly. So once again, the chin is up, the patient should look up at the ceiling, and this obviously works very well by doing it by yourself. You pull the lower lid down very firmly, and this is exposing the lower lid cul-de-sac. You put the drop in there, and then you let go, you blink, drop goes everywhere, and then you're done with that. Now, an alternative technique for very, very anxious patients is
pass the internal sphincter and instill the contents by slowly squeezing. Remove your finger or the enema tip and wipe the client's anal area with a washcloth or tissue. Discard your gloves and wash your hands. Ask the client to remain in bed or on his side for 10 minutes to keep the suppository or medicated fluid in place for better absorption. Place the call light in the client's reach if you administered a suppository containing a laxative.
Mr. McGee, everything looks good for you to have your medications. I'm going to get them ready for you.
To administer oral medications, perform pre-administration assessments, such as taking the pulse or blood pressure if necessary. Deliver medications to the patient at the correct time, and identify him according to facility policy. After explaining each medication's purpose and action, allow the patient to ask questions about the drugs.
I'm going to be giving you digoxin today for your heart. And a stool softener, your prednisone, and a cough medicine for your cough. Do you have any questions?
No, I understand what you're saying.
With the patient in a seated or side-lying position, administer tablets or capsules with his preferred fluid. If desired, let him hold solid medications in his hand or a cup before placing them in his mouth. If a patient can't hold the drugs, place the medication cup or a spoon to her lips and gently place each drug in her mouth one at a time. Don't rush or force the medications. For a sublingual drug, have the patient place it under the tongue. For a buccal drug, have the patient place it against the mucous membranes of the cheek.
Mr. McGee, I have some medication for your chest pain, and it goes under your tongue. I'm going to have you open your mouth and lift your
With
tongue
either
and
type
drop
of
it
drug,
under your tongue.
instruct the
Just
patient to let it dissolve and warn against swallowing it.
Lift your tongue. Do not chew or swallow that. Just let it dissolve under your tongue.
Similarly, caution against chewing or swallowing a lozenge. To administer a powdered medication, mix it with liquid at the bedside and give it to the patient to drink. Administer an effervescent powder or tablet immediately after it dissolves.
Mrs. Greer, I'm going to give you some more medicine. Just go ahead and take a sip of that. Mr. McGee, can you open your mouth and show me that all of those pills
Stay until the patient has completely swallowed each medication. Ask him to open his mouth if you're not sure whether the drug has been swallowed.
Mr. McGee, I'm going to be giving you some medication in a little bit that might upset your stomach, so I'm going to give you some crackers to eat right now.
For a medication that should not be given on an empty stomach, offer a snack such as crackers if not contraindicated.
Mr. McGee, I've got a teaching sheet here that I'm going to be leaving with you. It's regarding the medications that we started you on.
As part of your follow-up care, verify the patient's understanding of each medication's use.
Digoxin, Colace, and your nitroglycerin.